believe I have Mr. Dominic Fede on the line. Sir, can you hear me? Mr. Fede, can you see me? Can you hear me, sir?
Yes, I absolutely can. How are you doing today?
Oh, I'm doing fine. How are you? We're long time.
Yes. Good to see you again.
And you too, sir. You too. Thank you ever so much. I know you have a very busy schedule. We know an important event is going to happen later on in the island, that the Prime Minister, Alan Chastanet, is going to address the nation in regards to the lockdown. We would hope that we could get a link that our people over here could actually tune in at that time of the address. But thank you, sir, for coming through to us. I do have a few questions, and I'm going to kick off with this first one. How has St. Lucia been coping and dealing with the COVID-19 crisis?
I think we've been really good. I think, if I must say, the World Health Organization just a few days ago would have said that we are among only 2 countries in the world to have been corona-free. So we've had at the time 15 recorded cases, 2 of which were British tourists on island, and we've repatriated them. And in addition to that, all of our cases have recovered except for 2. So we've only got 2 positive cases on island. So we're really thrilled, and I think that has boosted a lot of confidence in a lot of the people on island in our health capacity and in the skills and dexterity in the Ministry of Health.
Yeah, I was going to say that next, sort of coming on to that. How has the pandemic impacted on the country's economy when we think about tourism, etc.?
Well, it's been absolutely devastating. As we watch the world economy, it makes us even more nervous. As you know, St. Lucia's economy is dependent on tourism, and there's a complete lockdown. We've got 0 tourists on island. All the restaurants, all the hotels are closed. All the shops are closed. And so we're now focusing on, a very responsible reopening of the economy so that we can put our people back to work, but at the same time, ensure that we optimize and to prioritize the public health situation on island so that a lot of our people can remain safe, and we can at the same time create livelihoods for them.
Yeah, and I mean, you just said it there, tourism is at a standstill. The country's been locked down for weeks now. How do you plan to come out of the crisis? I know I said earlier that the Prime Minister is going to address the country. Is it going to be staggered? Do you think it's going to be a kind of like a tier initiative going on slowly?
Yeah, but it's certainly a phased approach. We've opened certain aspects of the economy. So the construction sector is reopened. The government services and doctors' offices and a whole host of others. Some of our supermarkets have stayed open throughout because they're essential services, home and convenience stores. So there's a gradual reopening of our economy with a view to striking a balance between taking care of this pandemic, which we've done so successfully, but at the same time to ensure that it doesn't bankrupt the country. From the economic standpoint, we have seen an absolute devastation. Like I've said, the government revenues have fallen by about 70%, which really has become a real problem for small countries, not just in St. Lucia, but in the Caribbean. And now it is becoming extremely difficult to run government because of the revenue losses which we have endured in the past months. I mean, this is absolutely fluid. We see that big corporations all over the world are having tremendous difficulty, and the same applies here in St. Lucia, where our companies are a bit smaller in terms of size and scale, but they too are feeling the effects of this pandemic, which really has been nothing but a devastation so far economically.
Yeah, of course. But, we talk about how St. Lucia, no deaths. You're saying it literally 15, 16, 17, if you will. But how do you attribute that success in keeping the records down to that level, no deaths at all, compared to the rest of the world? What is it that you did?
I think that we shut down pretty early. I think there are 3 things, social distancing, testing, very important from very early on. And so if you go into Castries now, they're going to be 9.5 out of every 10 individuals you see will be wearing a mask, because we've all taken this on board, that this is a serious pandemic, that this is a health crisis. And regular updates, daily updates, a lot of health information, giving the Ministry of Health a lot of support. So we had a very all hands on deck situation where every department in the government was playing a role in helping the Ministry of Health in some way to fight the pandemic that we were facing at this present time. And so our team really we just followed the global rules, and we did so without complaining. And there was a week where we had a 24-hour lockdown where no one went nowhere, no supermarket, nothing was open. Everyone just stayed at home. And I think that played a significant role in what we're doing. So I think we've got to be, we've got to take some short-term pain to the long-term gain. If we don't do the shutdown right, if we don't do all the things that are necessary with coronavirus right, we're going to go through it much longer than is required.
It sounds to me that you're saying what you're saying. Perhaps Prime Minister Alan Chastity will not be.
Okay, I can't hear you. I'm going to have to take a minute to come back in, because I can't hear you now. A call came in.
Do that, sir. Because
just give me 1 minute.
No problem. Okay. We've got Dominic back. Thank you, Anthony. Dominic, can you hear me?
Yes, I can. Absolutely, loud and clear.
Excellent. Yeah. I'm just going to say that last bit when you spoke there. I got a hint from that in his address today. It doesn't sound as if Prime Minister Alan Chastity is going to really give much, only a limited amount of lifting of restrictions.
No, we're going to go back now into implementing key sectors like tourism, as scary as that sounds. But what I think COVID has done, in the same way that 9/11 has done, it is going to change the way that we travel for the rest of our lives. And so what St. Lucia has been doing is to be very proactive. And we ask ourselves, even while we were in the lockdown, we were meeting in the cabinet and with the health officials to say, okay, there is stage 1, there is stage 2, there is stage 3 in the public health fight. But we created a new stage called stage 4. And we said, what is stage 4 going to look like for our hotels? So it means that, therefore, if someone is leaving Gatwick Airport to come to St. Lucia, we're going to require them to have a rapid test. Now, we know with the rapid test, it is not completely reliable. And so, therefore, you come through our airports, your temperatures are going to have to be checked. And if there is anyone that has a fever that resembles anything like a symptom related to coronavirus, we're going to isolate you. We're going to quarantine you in your hotel, and we're going to monitor you until we can test you. It will require 24 hours in terms of isolation, so that we can do a proper test to ensure that you are negative. And I think we've got to now make sure all of the hotel employees, in the same way you run a hospital, that they are wearing PPE supplies, that the place is properly sanitized, that people are socially distanced, that we don't do any buffets, that we ensure that we have limited excursions. We don't want people to go into clusters of our towns and villages, but rather to go visit in an orderly, organized, managed manner, to go visit some of our sites and attractions and some of the beauty of our country. But I think that the new reality of COVID and how tourism is going to work, it is going to change forever. A lot of the airlines we're talking to have already agreed with us on the American side that they are going to have no middle seating. So you're going to have seats on the windows and also in the aisle. Unless a family is traveling, of course, then you can put them together. And these are a lot of the procedures that we have just thrashed out in order to make our country safe for the workers of St. Lucia, for the tourists that are coming from all of our major source markets, and as well in the best interest of this global pandemic, which is affecting all of us, whether we are a small country, whether we are a big country like the United Kingdom. And so what we've got to make sure is we continue sharing information, learn from each other, and work in the best interest of each other.
Yeah. And that's what part and parcel of it is, that every country is looking at the second peak, if you will, that if you lift too many restrictions, that may happen. And so this is what St. Lucia obviously is thinking about rather seriously.
Rather seriously, but it has to be managed. It has to be highly regulated. We were on a call with our hoteliers yesterday, and we've indicated to them that what you know tourism to be like, just say goodbye to that, because life has changed and there's a new normal in tourism, and the SOPs are going to have to be extremely stringent in the best interest of everyone. So you've got to make sure that when you say lockdown, you are locked down. You know, I saw an interview with some of the people from some of the Eastern, Southeast Asian countries. And they were asked, why hasn't the West been so successful in containing this virus as places like Taiwan and Singapore and Hong Kong has been? And they said, listen, when you say lockdown, you must mean lockdown. It cannot be that you're locked down and people are out in the parks. It cannot be locked down and people are out and about in the streets. It cannot be, you're a lockdown, you're a lockdown. Do it properly for 2 weeks, and then everyone can move on with life. I mean, you can take inspiration from how the Chinese have just come out of this. You've just got to lay the gauntlet down. This is what it is. If we don't follow the rules, all of us will die. And that is simply it. There's no if, buts, maybes. And we have just had a very, very, very strong and draconian measure on it. If you know the island well, we've actually put checkpoints and zones. We've put curfews in place. The police patrols are there. And if there are people who are found in the streets that are not supposed to be there, you know what, you're arrested. You've just broken the law. The first thing we did is that we declared a national emergency. And that national emergency, what it did, it gave the government certain powers in order to put curfews in place at a whim, and to ensure that other legal things that you need to do, that is in place from very early on. So unless you social distance, unless you test, it is difficult to know what you're dealing with. Sensitize, social distance, test, and you're going to win this fight.
Well, St. Lucia certainly winning the fight. And I was wondering, because you have been to the UK several times, and I know you're keeping up to date with what's happening in the UK. And when I hear you say that when you say lockdown, it shouldn't be lockdown, obviously, you know, we have a semi-lockdown. What do you think of that? You know, the government of St. Lucia, when you look at the UK and how we've dealt with it.
Well, you know, it's very straightforward. A lockdown is like being in love. Are you in love or you're not in love? It's yes or no. It can't be semi or partial. You've got to enforce it. And I know cultures are different, and what governments can do in various countries, it might be harder to do in other countries. I know that the Asian countries have a history of subjugation, and what their governments can do, governments in the West may find difficult. So I think that we've got to cooperate as well as citizens to ensure that we make the enforcement right. You know, you're not going to die by not going to the coffee shop for a couple of weeks. You know, you're not going to die if you don't go to the theater. You're not going to die if you don't go to the mall. A lot of the things that we have refused to stay away from are not necessities in life. You know, once there's food at home and your family as well, I think that that's important for 2 weeks. And you've got to just be very simple and matter-of-factly about this. And I think that this is what we've done. Did we get political pressure? Yes, we absolutely did. But a lot of those people who, you know, originally criticized the shutdowns or the lockdowns and said that you were too draconian, you know, when the results came out, you know, you just shut them off.
There you are. There you are. My last question. I mean, this is a brief because I've only been told this. I just literally got some information about this, but I understand that Prime Minister Alan Chastity has been appointed as the Administrator for Border Control across the Caribbean.
Yeah, so what we're doing is we're taking a regional approach as it relates to how we open tourism back up. Several countries have got several dates. I chair the Caribbean Tourism Organization as well, as St. Lucia's Minister of Tourism. And so we are working very assiduously to ensure that we have a regional approach to tourism. We're going to focus on the accommodation sector first. We are nowhere ready for cruise ships. That's a whole different ballgame, and that's a whole different management and scenario. But what we're going to do is we're going to have very, very small amounts of tourists on each destination that we can manage. Luckily for us, our tourism is not city-based. It is more on peninsulas and enclaves. And so hotels are like communities that are socially distanced naturally. And we are going to be able to control those situations. We've put in a number of protocols. One, to try to make it easy for the guests, but we've made it clear to all of our stakeholders that what travel is, don't expect it to be pre-COVID. It's a new thing. You know, in the same way that before 9/11, you didn't have to take your shoes off. You didn't have to go through these machines that scan your entire body. You didn't have to take off your belt. But now COVID is going to cause you traveling to do some things. And I think that it's important that we all do that to keep each other safe. I think the risk alternatively is too great. But back to the question on the Prime Minister, he has been a superb leader in leading the country through this. He's made a lot of time and addressed the nation at every point. Our cabinet, for example, have been virtual or socially distanced. Our parliament, for example, has been reduced in terms of the number of people who have been able to sit in the chamber at any given time when we go there to make a specific law. And, you know, we've just had to change life. You know, supermarkets have had to put in protocols. If you don't have those protocols and you're not passed by the public health agency, you just don't open. Simple. If you violate the protocols, we shut you down. We've had a situation where a call center and a few other businesses were shut down because they didn't follow the protocols. And we've just been very strict and matter-of-factly about it. We've got police checkpoints all over the island to make sure that people are staying in their zones. We've zoned the country. And we've said all you need right now, you need a bank, you need a supermarket, and you need a petrol station. That's it. And, you know, once we zone the country and you can get those things in your area, you don't need to be going in different parts of the country that you don't need to be. And these are some of the things that we have done in ensuring that we keep the country safe. But in doing so, what you do is you curtail access for vulnerable people to access supermarkets in a lockdown and access food. So the government has had to also step in to provide care for those individuals. Our hospitals have been upgraded. Luckily for St. Lucia, we had a new hospital, a state-of-the-art hospital, which is called the European Union Hospital, which was a grant we got from the European Union, and we were able to open the facility, which had a very positive impact on our healthcare capacity. In addition to that, our old general hospital, or the previous general hospital, we have just redesigned it with the World Bank to become a respiratory hospital. And many St. Lucians who are watching might know it as the Victoria Hospital. And that hospital is where we take positive patients into care. The other thing is that we've been very strict in quarantine. So with our hotels being closed, we've used a lot of the hotel facilities as quarantine, where at present we have about 300 cruise ship workers who have returned from the United States, which has now become the global epicenter for this virus. And we said that you can't go back into community unless you have been medically managed and monitored for 14 days. And so once you do that and you're strict in the quarantine, then you're absolutely fine. So you could be the Prime Minister, you could be a government minister. Once you're out, you have to be quarantined. And we've had to set an example in various cases. I mean, I've been into a petrol station once in the convenience store, and I forgot my mask in the car, and you should see how people went at me, and I had to go get my mask back in the car. So there's that level of sensitization that none of us are getting off the hook here now, you know, regardless of who you are.
Absolutely.
Wear your mask. We're gonna do this well. We're gonna do this right. And if Minister, we're very sorry. If you don't put your mask on, you just can't come in.
Yeah.
And I'm just so proud of the way that St. Lucians have behaved. I think that it has brought the best out of them.
Absolutely.
I was so proud, you know, sometimes as small countries, you don't get to be a world leader in too many things. And, you know, I was very, very proud to see when the World Health Organization named two small countries, St. Lucia and St. Barts, as the two countries that were in the green, because for an entire week, we had 0 positive cases.
Yes.
We have a situation where neighboring Martinique, because of there being like a European territory, they have had a lot of cases there. And we do have some of our nationals who have been living there, and they have come through the back door.
Oh. Oh, okay. Oh, very good there, is it? I think we've
avoid the quarantine.
Yes.
Be stringent and to lay the gauntlet down and to lay the law down.
Yeah, of course. Well, this is why St. Lucia is a success story. You've done it right. You've done it completely right. At this point, I have to say to you, thank you ever so much, Dominic Fede, Minister of Tourism, St. Lucia. Thank you ever so much for talking to us and sparing the time to speak to us today. Thank you, sir, and do take very good care of yourself.
Okay.
Wow.
Yeah, that was some really, really interesting news. I'm just seeing the time. We are over like nobody's business.
Ow!
So I just want to say thank you so much. 2 hours have flown by quicker than I could ever imagine. It's great for lifestyle to be back. Thank you to everyone who's joined us on Facebook, YouTube, all the networks. Thank you to MediaNet Live for promoting this in such a way. Thank you, Pam. It's been great to see you again. I just want to, my last message is Happy International Mother's Day. Over in the UK, we had it earlier in March, I believe. That's the one. But I've got aunties, I've got family all over the world, and there are ladies all over the world who deserve it. So I'm just putting a big, huge international Happy Mother's Day out to you all.
Exactly. Not to forget that you can watch this show. Any friends or family that have missed today's show here, they can watch it again on Ben TV Sky platform 458 from 10 till 12 noon, and that's going to be on the 15th. And that is on Friday the 15th from 10 a.m. till 12 noon, and that is Sky 458.
Spread the word. Tell a friend to tell a friend.
It's been an amazing experience. But Anthony and I will have to reiterate this, and every time we end this show, we got to say these words: stay safe, stay strong,
indeed,
save lives.
Indeed. And as you just saw from the previous minister, keep the distance. As much as it's tempting, it's worth the wait. Good things come to those who wait. Keep your distance. You can have that hug when the time is right.
Yeah.
Until then, do what we're doing. 2 different screens. There you go. Virtual hug. There you go.
Blessings to you all, and we're back again next week, same time.
That's the one. See ya.